We've just heard, of course, from Health Minister Dr. Motsoaledi, who's detailed their own findings insofar as the cause of death of 6 children who died in Naledi a few weeks ago. It's now been identified that a group of substances called organophosphate was in the bodies of the children who sadly died, emerging from the toxicology reports that have now been confirmed. Our Hasina Gori was part of a team watching that media briefing. She joins us now live. And Hasina, of course, while this has been revealed, there's still a whole lot more questions around how this particular substance got into those children's system.
Good morning, Ayanda, and we've just come out of a briefing with the Department of Health and the Health Minister, Motsoaledi, just announcing one of the causes or the cause of these 6 Naledi deaths, which were from the foodborne illness outbreak that happened earlier this month, and he has with the substance as organophosphate. This is a pesticide which is not meant to be used in households, not meant to be used around humans. And this comes after much investigations of this foodborne illness, not just in Naledi, Soweto, but also across the country, where children were falling ill after eating Naledi snacks. What we also know is that last week, 100 officials, including health inspectors, agricultural inspectors, those from border management as well as from Home Affairs, all went into Naledi, Soweto specifically and investigated and went through and inspected over 84 spaza shops in that area to try and understand what could be the cause of this foodborne illness. They took swabs of various different items. They looked at what could be these causes. There was a suspicion that organophosphate was the cause, but they were looking for definitive evidence. And at this stage, we're told by the minister that they're still waiting for the results of those swabs that were taken. Those are still being tested, but the toxicology report that they have right now that has been thoroughly investigated by through the postmortems, through those that work within the health industry, and shown phosphate is the direct link. What they also to understand is how did that end up in the spaza shops, how did they become into the streams of the children, and what the at the stage known that in some cases the spaza shop owners have confessed to buying it to kill rodents and to deal with that infestation. Also, it's believed that it's sold to communities also to deal with the pest issues in that area. What also has come under the spotlight is the irregulated industry, the small and medium enterprises, also with spaza shops. And to bring into this conversation, I want to bring in the Acting Director, Mr. Harden. Thank you so much for speaking to us. We've heard from the Minister. We've heard what could be, what is the cause right now. But what you're still trying to understand it end up in those spaza shops, and as the NCC, how are you feeling hearing this information, and what do you think needs to be done to regulate this industry to ensure we don't have these kind of outbreaks again?
Thank you very much, and you are right. We had from this briefing with the Minister of Health, and as the National Consumer Commission, we are part of the net joints operation, and we were in some of the inspections in Naledi with the net joints. What is clear to us is that there is a need for retailers and spaza shops in particular in South Africa to be aware of their obligations in terms of the various laws that are out there. Particularly from the Consumer Protection Act, they need to know that the goods or even the environment within which they trade is a safe environment. It's an environment that's not prone to contamination of foods that are there and that are sold. That they must not sell expired goods. They must sell goods that are properly labeled. And as you have heard from the briefing, we are still awaiting tests on those particular spaza shops, whether the organophosphate material has been picked up in those areas. And that will then inform the course of action from a regulator, from the application of the Consumer Protection Act.
You mentioned that your organization and NCC was part of the Nat Joint's inspections that they did, what were some of the key findings that you saw while going into those spaza shops that have raised flags for you?
What we have picked up, because in addition to the tests that were being done, our investigators also were looking at general compliance with the Consumer Protection Act. And there's still a huge concern around labeling of products. So products that are sold there are not properly labeled. They are labeled, some in foreign languages that consumers cannot even understand. We have picked up that some retailers are selling even expired goods. This to us is a big concern. It's a concern. With this operation, we are able to pick up this, and it is for us now to follow up and do these inspections widely. We have been doing this in other provinces, and we will now increase the intensity to ensure that our consumers, and you can see particularly vulnerable children, are not exposed to expired goods or improperly labeled goods in these retailers.
Thank you so much. That was the NCC's acting director speaking to us here. Through that briefing, heard from the Minister of Health, Motsoaledi, on what the cause of that foodborne illness outbreak deaths was, and that's organophosphate. But he also mentioned, we heard on Friday evening that 4 people were arrested. We know now they're not directly linked to the foodborne illness, but they are suppliers of a pesticide, not organophosphate, but carbamide, and they were found in possession of almost 1.5 kgs. They are facing separate charges because that is also an illegal substance. But what we also heard was in one of the pockets of the children that had passed on, that's a 6, that passed on from eating a suspected contaminated goods, they found a packet of chips that has also been tested. At this stage, there was not organophosphate found in that packet of chips. So we're still waiting on results, and the health department is also to find the link and how exactly organophosphate was found in those spaza shops and then found in the bodies of those children who passed on. There's also been a caution to parents to warn children and to ensure that they buy snacks from places that are clean, uncontaminated, and to ensure that there's safety done in this, especially now given light of the that we're seeing outbreak across Gauteng, but also across various provinces. So there's been a cause for caution, but also for medical practitioners, there's been some alerts sent out on what exactly they could look out for, and also treatment if they are found with patients that have organophosphate poisoning in their body. So this is a developing story. There's still questions that needs to be answered, also results that need to come back. But right now, back to you in studio, Ayanda.
All right, Hasina Gori, thanks very much indeed. Hasina reporting live there from Kempton Park in Gauteng.